Now we're here thanks to the common pursuit of solutions, and I thank APHRC, the premier research to policy institution, and ATNi, global challengers of the food industry, policymakers to shape healthy food systems, and they've brought us together so we can be able to think and how we move forward.
Let me reflect on our impact, which actually lie in the result of the evidence we generate for decision making and the ensuing policy action and result of the project we tackled across Africa.
We exist to transform markets for nutrition, to try to improve the business case for nutrition, to try to improve how we engage with the private sector, and to make sure that their contribution, which is critical, is responsible and accountable.
As a region, we believe that this is a significant opportunity for collaboration and partnerships so that we can come together to explore strategies of enhancing promotion for healthy foods.
Nutrition is a real and not an abstract agenda. You are seated there because of nutrition, isn't it? So this conversation needs to be taken to that higher level, that things are not the same. So what are we telling policy?
We see also a relatively positive development that more food companies start developing or using international criteria to define what's healthy and what's not. Because we see many companies globally still use their own criteria to determine what's healthy or not, which might be confusing consumers. So we really recommend companies to use government-endorsed or internationally recognized criteria or models to determine whether products could be marketed to children.
We shall have a presentation first before we get into the panel.
All these aspects have a very strong bearing in terms of which food appears in the market. And of course, if you cannot harmonize this, then it becomes very difficult to harmonize the policies as well.
What are your thoughts around the current draft guideline on FOPL, considering that countries first need to have NPM?
I'll give an example. Like in Tanzania, we had our food fortification regulation reviewed because previously it was only basing on the large-scale millers, but right now we have reviewed it so that it can cover all the millers who are producing the vehicles which have been identified in that that regulation, because we've seen that there's advancement in technology, advancement in the infrastructures at the Bureau.
If data was already collected in Kenya, is there any reason we need to collect it in Tanzania and Uganda and Rwanda and Somalia, if we're really talking about an East Africa level, a regional level policy for harmonization?
We call upon our partners if they can support, and we have a regional nutrient profile model and then the front of pack, and this requires data and research.
We are in the regional dialogue on food environment policies that has brought together several countries, including Ghana, Tanzania, Uganda, and Kenya, of course. And the purpose of this meeting is just to look at where we are at in terms of food environment policies and its relation to the prevention and control of non-communicable diseases. So the diseases that are at play, that are directly or indirectly affected by nutrition, are like cancer, diabetes, hypertension, and quite a number of cardiovascular diseases. And therefore the wellness of the heart and the general body can result in or prevent non-communicable diseases. And therefore food is a very important factor to prevent diet-related non-communicable diseases, and we know and we can strongly state that nutrition has a very critical and foundational element to health, and therefore the conversations in this meeting are relating to that. What policies can be put in place to protect the undue influence of eating unhealthy foods.